Market access, a new element of the value chain. Market access Episode 4. Professor Mondher Toomey invites you to the lecture. If you haven't seen the previous episode about the value chain, please come back to it. Imagine market access is red and regulations are blue pawn in this game. Let's start the game. Market access is different from regulatory. Regulatory follow well-established guidelines, while market access ultimately rely on a negotiation that aim to align value and price from payers and manufacturer perspective. Regulatory assess requirement to meet efficacy, safety, and quality with little or no room for negotiation. While market access can always trade off perceived value and price, regulatory is dealing with certainty. Regulator wanted to be certain that efficacy, safety, and quality meet requirements, while payers deal with uncertainty. Let's open the payers card. They wanted to understand what will happen to patients once a product is launched. The payers aim to minimize the uncertainty at time of launch. Regulation and requirement are transparent for regulatory, very specific, and usually stable over time, while payers' requirements are evolving fast, often unclear, and not specific enough, leaving more unpredictability. Regulatory is almost global, once approved by FDA and EMA, except Japan, little additional requirement are needed to qualify for marketing authorization globally. Market access is country-specific and in some countries, like for example Italy, Sweden or Spain, is even region-specific. Now let's explain the difference between market access and marketing. Marketing is the turquoise pawn in our new game. Marketing is perception-based, while market access is evidence-based. Marketing rely on association of messages to create a perception that will become reality. Market access can mostly rely on robust evidence. Now we are on the key opinion leader filed. Marketing search the support of key opinion leader in order to influence adoption of a new technology. While payers are highly suspicious toward call and discuss with lay physician to understand how they may value a new technology. Marketing audience is usually not accountable for expenses. What about the payer audience? For key opinion leader, more drugs means more ammunition to fight a disease, while for payers a new drug is just more cost until it is proven to bring added value. Market access is a new paradigm that has become rapidly an instrumental tool for pharmaceutical manufacturers. Market access is a country and even region-specific process. It covers an heterogeneous and complex area with a broad variety of regulations. It is a multidisciplinary field at the frontier of economy, business, pharmaceutical sciences, public health, and sociological sciences. It gathers information from multiple sources to aggregate them in a single consistent package that is summarized in a payer value proposition. It targets a price-sensitive audience. It happens to be the critical driver of all business cases. If you like the video, subscribe to our channel and share this knowledge with others.